I'm lucky. I'm one of the luckiest people on this planet. At first, you might not think that's true. My parents were immigrants from Pakistan. They came over to this country in the 1970s. I was born in a council house. We had one fire in that house over the winter. For the first few months, we slept on floorboards. Things weren't always so easy, but I was lucky. I was lucky because I was born into a system that gave my parents a home, that gave them the opportunity to get a job in a foreign country, which they did, that gave opportunities for their children to have an education, to have a free education, to have a system that allows you to climb if you work hard. When I was 5, there was only 2 things I wanted to do. I said to my mum, I either want to be a doctor, because I thought doctors were quite nice people, or I wanted to be a bricklayer. I'm a surgeon. Some would say that I've achieved both of those things. But I've achieved it because of the ability and the system that is in place, that I have health and I have opportunity. And what I'm going to talk to you about today is the way that the world is structured that doesn't give that opportunity to everybody else, and what little bits we can each do to try and spread that opportunity. So when did I find out that I was so lucky? It was probably when I was 7 years old. At 7 years old, my parents took me to Pakistan. The world was amazing. I had never seen anything like it. It was dirty, it was dusty, it was polluted, it was crazy. But I loved it because people were people. People are the same all over the world. But what I remember is going with my mum to the local market. And when I went walking through the market, I saw this girl. I mean, I was 7. I think she was about 7 as well. She was wearing rags. She was covered in dirt. Both her limbs, her lower legs were missing. And she was on this trolley. And she was just pushing herself along on this trolley and begging for money. And I asked my mum, I said, Mum, who looks after her? And my mum didn't have an answer. I am so lucky. So I continued to grow up. I was a teenager, and as a teenager, I went through all this angst about the world. It's not straight, it's not fair. You know, what are we going to do about it? And, you know, we tend to grow out of that. Well, I never grew out of that. But because of the system I lived in, I could continue to do what my heart wanted me to do, which was to become a doctor. And I did. I've succeeded very well. I've become a doctor. I've become a surgeon, which is what I wanted to do. I also work at UCL. I lead a big research team looking at ear disease, trying to improve hearing for people around the world. So that system has allowed me those opportunities. And I was quite happy. It felt that I was doing something that was consistent with my own values and that things were progressing. But I went back to Pakistan 10 years ago. I was actually on honeymoon. I was traveling through Asia, and my poor long-suffering wife who's sitting there in the audience will tell you that even on honeymoon I don't turn off. Whilst I was in Pakistan, one of my cousins, my parents actually come from this place called Sialkot. We were visiting. And Sialkot, unbeknown to me, actually produces 80% of all the world's surgical instruments. And knowing that I was a surgeon, my cousin said, well, why don't you come and see how they're made? I thought, great, yeah, that'd be interesting. So it was quite a stark contrast to the sort of environment where I was using these instruments. We have these clean, safe, sterile hospitals where we feel like we're doing good. Surgical instruments in Pakistan, which, as I say, are 80% of the world, supply the whole world, are produced sometimes in these small sweatshops where there's 50,000 workers working on grinding machines, polishing, finishing these metal products. They work 11 or 12 hours every day. They work 7 days a week. They get paid, often a piece rate, which means they get paid for the work they do. If they're ill, they often have to borrow money, which means they are linked to their employer. Half of them are illiterate, half of them enter the job because they have to pay off family debt. Of those 50,000 workers, several thousand are children, some as young as 12, some as young as 7. And they're often working because there's no real opportunities. They don't go to school. They would love to go to school. They hate their work. They get injuries, sometimes serious. Sometimes lives are lost, limbs are lost, families starve. This it wasn't consistent with what I signed up for. I thought, hang on, we're doing health. Surely we're doing good. But health is supporting this. And this is a problem. As I've started to work on this, I've realized it's not just surgical instruments. I mean, this is a report from a glove manufacturing unit. So they make surgical gloves. This is in Malaysia. It's the second largest glove manufacturing unit in the world, because Malaysia produces most of the gloves. And at first thoughts, this particular investigation, everything seemed okay. But when they delved into it, all of the workers on the floor were immigrants, often from countries like Vietnam and Bangladesh. Most of them were paid over $1,000 for the privilege of coming to work at the factory, which they were then paying off in terms of debt. They worked 12 hours a day, 7 days a week. They got latex burns. They were subject to physical and sexual harassment. They had their passports confiscated, so they couldn't leave the compound. And this factory is producing gloves for major brand names all over the world. I was in Mexico a few years ago. This is Miguel. Now, Miguel works threading surgical masks. He used to work in a factory, but the factory can no longer employ him. And the reason it can't employ him is because there's so much competition from China in particular. The price keeps on going down. Now, if you keep a worker in your factory, well, hang on, according to the law, you have to pay them a minimum wage, you have to pay them health benefits, you have to pay them social security benefits. The factory owner said, I'd love to keep Miguel in, but I can't afford it. So Miguel now works at home. He threads around 3,000 masks a week. He gets paid for the work he does. If he gets ill, there's no real money. Sometimes the children have to help. So how have we allowed this system, and what is wrong with this system? I suppose it comes down to these notions of capitalist growth, and I'm not against capitalism. I think it has lots of positives, and it's allowed the world to develop. But there are some difficulties with it. So some 30 years ago, all the big people got together and decided these trade rules. The trade rules were designed to open the world, to allow the world to trade, which in a global world seems like a good idea. We'll have open competition. But of course, what we're going to ask about is, what are the products that you are able to give us? What's the price? And when we have a globalized marketplace, well, actually, we had globalized the cost of raw materials. And what we're competing on is how little we're prepared to invest in our workers. And I'm afraid I think this is the consequences of that. We've seen this in other sectors as well, but we're seeing this also in healthcare. Wherever we've looked with high throughput, low complexity medical products, we found this problem. That perhaps what we're doing in health is not protecting these workers. So although those trade rules were designed to create opportunity perhaps for the whole world, it doesn't create opportunity. These people are locked. They have no way out. There are alternatives. So some 8 years ago, as a result of this, I helped to set up a group, the Medical Fair and Ethical Trade Group, currently under the British Medical Association. And we've been working hard to try and change this system, to say, actually, there needs to be an alternative. And that alternative is actually saying we have to respect workers. So this has been done before. This is not something new. We can use existing systems. I work with an organization called the Ethical Trading Initiative based in London, which has been doing this for 16, 17 years now in things like the garments industry, in terms of things like agricultural products. We have a history there. We know that things can be done differently. And we're just trying to bring that into healthcare. So I'm working with hospitals to try and get them to adopt these policies. I'm working with an organisation called NHS Supply Chain, which is the single biggest supplier to the NHS. They have been instituting contractual requirements that if you supply the NHS with products, for example, surgical instruments, as of last year, you must have a system in place to protect worker rights. Yes, we can talk about the price. Yes, we can talk about quality. But first of all, I want you to make sure that you have minimum standards for your workers and that you look after them. We're also working in other countries, because this is a globalized world. We need a globalized solution. So there is interest and work that we do together with Sweden and with Norway, interest from Germany and Italy, and we're going to expand this. And I'm very proud to say that because of the industry I work in and because of the people that we are, people do care, and we're slowly but surely trying to change these systems. There's still work to go, but it is working. I was in Pakistan 2 weeks ago, and I actually went to a surgical instrument factory that the NHS is purchasing from, and I spoke to Mohammed, and Mohammed has been working in this industry for 35 years, and he's seen a change. He gets paid a minimum wage. He has better health and safety. He can speak to his managers about the problems. His children go to school. They have opportunity. And so I say to you again that I am one of the luckiest people on this planet. But what I hope is that all of us can, in our little ways, our bigger ways, we can all, through the luck that we all have, try to make sure that we spread that luck to the global population. Thank you.